Another challenge that may happen in the postpartum period is medical complications. So all pregnancies are different. Even in the same woman, all pregnancies are very different. There are women who get complications in pregnancy or after childbirth. And some of these complications may be things like high blood pressure, it may be diabetes, it may be excessive blood loss, what you call postpartum hemorrhage. Sometimes it could be infection. Sometimes it could be lung problems like a clot in your lungs. Sometimes it could be the fact that you had surgery and things didn't go so well. Sometimes it could be admission even in the intensive care unit like ICU or HDU. So medical complications are common. Pregnancy is not a child's play. It can get ugly, and childbirth can also get ugly. So you are lucky if you had a smooth pregnancy. You are lucky if you had a smooth childbirth with no complications at all. But there are those people who they get complications after childbirth or in the process in their postpartum period, and this can be very challenging because sometimes it can, one of all, separate you from experiencing your baby and bonding with your baby. Maybe you are in another ward and your baby is in another ward and you can't really meet and bond. It can be very frustrating. Sometimes it could be a life-threatening condition, and just the feeling of you might lose your life and you might not be there for your baby. It might be quite challenging. So medical conditions are common. I would say this, please comply to medications and treatment that your doctor gives you. It is a season that may be very difficult, but eventually it will pass. Most people overcome these complications. Most people get well, and most people are able to bond with their children. So I understand how down it may be making someone feel, maybe someone who is going through this now, but try to take heart and know that you will eventually feel well and you will eventually meet your baby. The medical complications may not just be the mom. The medical complications sometimes is the baby. There are moms who deliver babies preterm, and sometimes when your baby is born preterm, depending on how heavy they were when they were born, that is their birth weight or the age at which they were born in terms of how many months into pregnancy were you. Sometimes they may need to be in the neonatal ICU or in the neonatal high dependency unit and away from you. And this can be quite challenging because then it means that first of all, you are not with your baby by your side. And the other thing is that you may need to take care of your baby while you're also recovering. And wow, this can be hard. Because sometimes you may have a CS wound. Sometimes you may also not be very well, of course, because you're also sort of recovering from a delivery process. And this can be very hard because you have to make multiple visits to see your baby. You have to keep expressing milk to go give your baby. And all these stresses can make the milk production quite low, which is more frustrating. There is the emotional bit of just not being with your baby next to you and seeing everyone else around you with their babies, and that can be very, very frustrating. There is the uncertainty of how will my baby fare? Will the baby survive? Will the baby not survive? Will I be going with my baby home? When will that be? There is the financial bit of it with the bills accumulating. It can be very, very challenging. So medical conditions with the baby or with the mother herself, or sometimes both of them, it can be quite a big challenge in the postpartum period. If you're one of these people, I would say, first of all, sorry that you are going through this. And second of all, again, take heart. Most of the time heals, and time solves a lot of problems. Give yourself time to recover. Give your baby time to recover. Get help. Get friends, get relatives, get medical help from your doctor, and from the nurses as well, of course, to just help you maneuver through this process. Sometimes you may even need to get some bit of therapy, and just someone to talk to you and help you maneuver through this whole period of recovery. So take heart and give yourself time and seek all the help that you can get to just go through this season. It will pass. There is nothing that stays forever. And every day every day your baby grows, every day your baby gains some weight, every day there is a chance that you are going to get with your baby and go home. So take that. And quick recovery to those who have this challenge.